Laura Suarez, and I'm the owner and lead physical therapist with Local Pediatric Physical Therapy. I'm coming to chat with you today just a little bit about your baby's tummy muscles and what it might look like if they're feeling a little bit weaker, maybe not engaging as well, and what that can look like with their gross motor skills. And then also just a few exercises that you can take home with you today to help your baby with these muscles. So first off, what might you be seeing that might say, hey, my baby's not engaging their tummy muscles well? So first, one of the first skills all babies need to learn is being on their tummy. So what might you be seeing? At first, when they get on their tummy, they tend to go pretty flat. So you might see a little bit of a head lift. And gradually, as they get better at being on their tummy, you're gonna wanna see their arms pulling beneath their shoulders and their heads begin to lift. So what does this cause? This causes the chest to lift off the surface a little bit and more weight being placed through the hips and the arms. So this looks good probably at like 3 to 4 months of age. So if you're still seeing your baby pretty flat to the surface, it means they're not engaging their tummy muscles well enough to pull their arms beneath them and lift their heads up well. Another thing you'll start seeing at about 5 months of age is they start lifting a hip off the surface to kind of rotate their body to pick up a toy on this side. If they're keeping their hips flat to the surface and their legs maybe just straight out trying to gain some stability, then they're not engaging their tummy muscles well enough to allow for that rotation in the hips and the weight shifting. Then when they start to do some sitting skills, you might again see the legs planted pretty far out, hips staying to the surface. So initially when they begin to sit, at about 5 months, you'll see this prop sitting with the hands to the floor, and yes, you'll see both hips to the surface. And then at 6 months, they start to lift their hands off the surface, still both hips to the surface. But when they start reaching for toys after this, if you're just seeing them move in their trunk and this hip is not lifting up well off the surface and their legs are staying pretty far out, it means they're not engaging their tummy muscles well enough to work all of the pieces of the body together. So you should see a hip come off the surface right there. So these are some skills to look for in tummies and then in sitting. And then when they start crawling, you might see kind of a planking position where they just straighten out their legs and lift their hips off the surface. So what we're looking for in the crawling position is them to be able to pull their knees beneath them, just like that. That takes a lot of tummy muscle to do that, and then that will lead to crawling, being able to balance enough to lift 2 limbs off the surface for crawling. So how can I help my baby if I'm seeing these things? Well, a couple of exercises that I like to do. One of them is if they're sitting, if you're noticing what I was chatting about in sitting, that they're just keeping those legs straight out and they're not trying to gain that mobility in the hips, what I would do is put them on your knee just like this, feet flat to the surface with their knees bent, just like that. You don't want their legs straight, because if their legs are straight, it means they're not engaging that tummy well. They're just pivoting around on their hips. So if their knees are bent, they're sitting down just like this. You want them reaching to the floor and coming back up to sit. So put a toy down there and have them come back up to sit. You might need to put the toy a little bit higher on another surface at first. And another thing is if they go straight to pick it up, that might be a little easier at first, and that's okay. And then work on gaining that rotation to each side to pick up a toy and come back to sit. Another exercise that I like to do, so if your baby is struggling with that tummy time, get on this is called a peanut or a large exercise ball, yoga ball, so to speak, just whichever ones you may have around, or you can get them at the store for pretty cheap. But basically I would put your baby on the ball and try to get the arms beneath, and you can roll it backwards just like this towards you. Roll the ball backwards, and that eliminates some of the gravity that's making it so hard for them to get their arms beneath them and their heads up. So we can kind of roll back, and as they get better with it, we can roll them forward. Now we want them to engage their tummy muscles more as they start that weight shifting that we were talking about on their tummy. So you can take them right here and kind of roll them to their side. I like to put my arm between their legs just like that. Kind of support them if you need to, and then I'll put my hand on their tummy to act like their tummy muscles to help those out. And you can kind of roll back and then roll forward. And what happens when you roll back, you're waiting on them to kind of try to sort of stop that movement, so to speak, so that they're not just falling flat to the surface. They're controlling it when you pull them back. So that kind of helps engage the tummy muscle. Another one would be if they're on their tummy here and you just bring the leg up, kind of bending underneath them right there. Just sort of engage that tummy muscle on that side, and then you can switch to the other side a little bit. We're just weight shifting the hips over to the side and allowing the unweighted leg to kind of bend up a little bit. So those are some exercises that can help with some of those tummy muscles that are giving us a little bit of trouble. And when we have trouble with our tummy muscles, it leads to some delay in our gross motor skills. It can also lead to difficulties with our bowel health. So we really want to get those tummy muscles under control so that we can work on those gross motor skills we need to work on. And when we're working on those gross motor skills we need to work on, it also helps with other things. If you have any further questions, please feel free to email me at Laura, Laura, at localpediatricpt.com. Again, that's Laura at localpediatricpt.com, or feel free to call me at 281-455-6437. I'd be happy to answer any questions, or if you'd like to get further help in coming in maybe for an evaluation to see if it's something that you just need a little bit more help with, feel free to reach out. Thank you.